Hello and welcome to another segment of Our Ventura TV. My name is George Alger and today's guest expert is Teresa Seeley, who is the Executive Director of the Conejo Free Clinic. Welcome, Teresa.
Hi, thank you, George.
Let's get right into what the Conejo Free Clinic is. Tell us a little bit about it.
Sure. The Conejo Free Clinic is a nonprofit organization, and we provide medical, legal, and counseling services for those in our community and even outside of our area for the uninsured and the underinsured.
Good. And how long has the organization been around?
The clinic was founded in 1976.
And I know you have a number of volunteers working with you. How many?
We do. Upwards of 70, and that would include volunteer physicians, doctors from UCLA and Kaiser, Amgen and Los Robles Hospital, and also doctors in private practice. Also would include attorneys and counselors to come in, and they all give their time voluntarily to our 5,000 clients a year.
Wow. Okay, now tell me what this free means in the name of Conejo Free Clinic.
Yeah. Well, the Conejo Free Clinic is not subsidized by the government or the state, so we raise all of our funds through private grants and donations. Some large organizations in the community and other private concerned donors in the community. So between the volunteer services that are provided and the funding, we're able to do quite a bit. We also get some very deep discounts from imaging, lab, and pathology facilities in the Thousand Oaks area. So our patients can see and have things done just like a regular doctor's office. So it's very rewarding for all of us to be able to go so far with our patients. And then if they do go beyond our scope of care, we have a full panel of diagnoses, and they're armed with that as they have to enter maybe into the county system.
Okay, now let me just walk through a particular, or any patient, I guess, or an average patient, not someone who has to go outside of your system. But so a person comes in and they get seen by a doctor. They're healthy or they're not, but they may require some medication or they may not. But at what point does it not become free?
Well, it's always free to our patients. We ask for a donation, and some people can't give a donation, and some people pay it forward. Some people will give a little bit more for the next person. But we do not have a sliding scale fee. We do not have a fee schedule. So all of our services are free. And a lot of people come to our clinic because maybe they have insurance, but they have a very high deductible. And so our goal is to keep these people from waiting so long that they end up in the emergency room. And a lot of those bills remain unpaid. So our goal is to really address that preventative care and get that chronic disease management under control to keep them healthy and at work.
Good. Okay, so if someone is interested in becoming a patient, what is the criteria? What qualifications do they need to meet to be able to do so?
Well, it's just a matter of giving us a call. At the time that they have their appointment, we do an intake, but it isn't really a qualifying or disqualifying intake. Certainly if a patient is more appropriately seen in the county by virtue that they already have Medi-Cal or another county program, then we will facilitate them and kind of advocate for them and help them learn how to access the resources that are more appropriate for them. Other than that, it's just a matter of giving us a call and making an appointment, and we go from there.
Okay, so there's not any income level that is pertinent to whether you can see them or not?
Nope.
Wow, okay. All right, and could you describe a little bit more about this differentiation between the Conejo Free Clinic and free clinics that may be funded by the county or government agencies?
Well, the difference there is that being a 100% 501c3 nonprofit, we are not subsidized, so we're not governed by the qualifying or disqualifying of a patient. We can see anybody that we want to. It's really nice too for our doctors, I believe, that they really enjoy coming to volunteer at the clinic because they can be creative, they can take their time with the patient, and if we have a patient that goes beyond our scope of care, we do have physicians in our area that will see our patients at their office to do certain specialty services that we can't provide in the clinic. So it's very satisfying for all of us to be able to do so much with relatively small resources per se as funding goes.
This is a pretty amazing resource. Are you able to handle most of the people that come to you?
We are.
Okay, well done. Could you speak a little bit about the doctors?
The doctors are extraordinary. They come from, again, all different specialities of medicine. For instance, we have a neurosurgeon who, in his private practice, he's a brain surgeon. He operates on backs, but when he comes to the Conejo Free Clinic, he practices general medicine. Now, having said that, if we have patients that have some type of issue with a back or a spine or another physiological appropriate finding, we would schedule them with that doctor. But they're all different specialties, but when they come, they're either going to practice women's health, pediatrics, or general medicine. And we do have pediatricians that come and general practitioners that come. And then in the case of our neurosurgeon, again, he's going to see patients as general medicine.
Good. Mm-hmm. Now, you have plenty of volunteers, it seems, but I imagine you might need more. Is that also true?
We can always use volunteer nurses, especially in our pediatrics clinics. There's always a need. It's a very specialty resource for pediatrics, so we're always looking for pediatric nurses.
Okay. Now, are there other volunteer roles available?
There are. We have receptionists that we rely on for our front office, and we have clinics throughout the day. So we have some clinics in the morning hours, we have some in the afternoon, and we have clinics in the evening too. We also have legal clinics once a week, and those clinics are at night, and we do need receptionists for that too, to cover those legal clinics.
Good. Now, you mentioned legal, and I wanted to get to that, and this is a perfect segue. What is the sort of tie-in with the legal services and the medical services?
It's interesting. We had a client come in years ago that was facing bankruptcy. So he came to file bankruptcy, get some guidance on that, and we found out at that point that he was suffering with diabetes and hadn't been to the doctor in a number of months and was very, very ill. So in the course of our taking care of his bankruptcy needs, he became a patient of ours. So there is a correlation. It seems it's a holistic approach to the community. Counseling also is another piece of the clinic that, of course, works in tandem with the physical health. We're treating a patient for depression. We can have a general doctor oversee that patient's physical care and then work in conjunction with the counselor to make sure everything is going in the right direction. Okay.
Now, you've been with the clinic for a long time. How long has it been?
I started with the clinic in 1996.
Okay. Well done. Now, so you're setting the vision for the clinic for quite a number of years now. But is there a founder of this clinic or that said, okay, this is really why I'm doing this?
Yeah, the clinic started back in the 70s, interestingly enough, when we had vets coming back from Vietnam and there was no public health available in Thousand Oaks. And there was no transportation to Oxnard where public health was. So there was a group of women who decided, this is something that we need to look at. And it started as a very small grassroots effort to do the typical things that a free clinic would do, the STD testing and pregnancy testing. And I don't think anybody at that time realized how it would then morph into what it is now, just like a regular doctor's office at a very high level, of disease control and management. So it's kind of it's humble beginnings.
Good. Now talk a little bit about the funding behind the clinic.
Mm-hmm. Well, the funding for nonprofits it's always a challenge. We rely on our grants and we rely on our donors, and we do have an annual golf tournament every year. Dr. Frank Dawson, who's been our medical director for over 35 years, spearheads that. That's one of our really big fundraising events. And then throughout the year, we do different presentations. We're funded by local charities, Rotary, and many civic groups that believe in our cause and understand the intricate part that we play in the safety net for the community.
Good. Teresa, what was, when you're out in the community telling folks that you're the director of this clinic, what is, the main question that people ask you?
Well, I think the main question people ask me is how much does it cost to be seen? That's always the big, because there's always, a free clinic is so different and unique in that way because, again, we're unto ourselves. We are privately funded. So we set our rules, and that's unique, and it's not something that, many people have not used free clinics before. In 2009, when we had the big economic downturn, we saw for the first time people who were coming in using a free clinic and they had no idea, that it existed and what to do and how to act, and it kind of blew them away that, they could actually be seen, and we weren't going to look at, an annual income and, ask for a payment. So
it is amazing.
Yeah, it's very rewarding for us to be able to do so much. And, some people are seen at our clinic and they get their needs resolved and then they do move on. If it's appropriate and they're able to, we do advocate for them to, seek care in the county if it's appropriate for them and if it's doable. But a lot of people have a lot of barriers. There's language barriers, there's transportation barriers, and there's co-payments, and, they get behind really fast with their debt. And then we're back to the issue of having somebody with a chronic disease end up at the emergency room, and that's what we want to avoid. Okay,
so we're just about out of time. I'm wondering if you could tell us a website so viewers could get more information, and also is there a summating message you'd like to convey?
Well, I would like to speak on behalf of the clinic and all of those that work at the clinic and serve at the clinic, that we believe that everybody should have access to health care. And if we can facilitate that and keep people healthy, to include mammograms for women, we have an extensive mammogram program that we not only do the screening mammograms, we do diagnostic and the biopsy, so that if she is found to have cancer, that will expedite her care. That isn't always the case on a county level. She has to first be diagnosed with cancer before she can qualify for the program, and time is of the essence. So I did want to put a flag out there for the mammogram program. Please visit, there's more information at our website at www.conejofreeclinic.org. I'd be personally happy to help anybody that gives us a call.
Thank you very much, Teresa. That's great work.
Thank you.
This is George Alger signing off for this segment of Our Ventura TV. Until we meet again.